Please give a warm welcome to Bleep Cancer founder and CEO, Yael Cohen. Welcome to the show.
Thank you. Thank you so much for having me.
I absolutely love the name of your foundation because anybody who's ever been affected by cancer in their family, that's exactly what they want to say
It's
to
exactly
cancer.
what we're all feeling.
Yeah.
You know, when Mom got sick, it occurred to me that nobody talked to my generation about cancer. You know, we're not in the highest risk demographic, we're not the largest donors, and we were just left out of this huge conversation. And it didn't make sense to me.
So your mission is to get the sons and the daughters to talk about cancer with their parents.
Exactly. You know, I think that we teach our parents more than any generation ever has.
And I think one of the things that's so important is knowing your body. And especially in your generation, you want to make sure that you aren't afraid to touch yourself and that you know exactly what's normal. You want to get to know your breast. And you can do this in a systematic fashion by either starting at the collarbone and going all the way across to the armpit. And you just feel with the pads of your fingers, the 3 pads of your fingers, you go around like that. And it's really, again, it's not definitely about the way that you do it, if you go up and down or if you go in concentric circles, that you just get to know what's normal. And breast tissue is going to be lumpy, bumpy. Anything you can isolate and define or feel a shape to is something that you want to talk about. You want to do this after your period because then your breasts are going to be less tender, so you'll be able to feel things better. They'll be less dense. And if you want to do it in the shower, that can heighten the sensitivity of your fingers for feeling things. But the more you know your body, I can't tell you enough how many of my patients have felt something on your own, because we only do your clinical breast exam starting at 20 every year. So, you know, if that. So, what you can feel on a monthly basis is huge.
And I think it's creating that shift away from doing a self-exam, whether it's breast or testicular or whatever it may be, and looking for something. It's getting to know your body so that if something does change, you're the first one to notice.
Well, in the fight against cancer, you want every weapon in your arsenal, self-exams and cutting-edge medicine. Dr. Lisa delivers the top 3 cancer tests every woman should know about.
In the fight against cancer, your best weapon is early detection. We know the routine mammogram is critical, but here are 3 other cancer screenings you have got to know. First, the Halo Breast Pap Test, a 5-minute non-invasive screening. Halo combines warmth, massage, and suction to collect nipple aspirate fluid from the milk ducts, where 95% of all breast cancers originate. Any fluid produced is tested for cellular abnormalities. Any woman above the age of 25 and with a family history of breast cancer should consider the Halo Breast Pap Test. Second, the HPV test for cervical cancer. Right now, the guidelines are for the HPV test for women's age 30 to 65, but speak to your doctor about when you should have this added to your routine pap smear. And finally, a colonoscopy. Colon cancer affects more women than all the gynecologic cancers combined.
Thanks, Dr. Lisa.
You're welcome.
Yael, thank you so very much for what you're doing.
Yes.